Hi everyone. In this diagram video, we are going to go over various anatomical terms, as well as some directional terms. As I go through and label them, make sure that you as well are labeling. And anytime I make comments regarding physiology of a certain structure, I will add a small little star next to it so that you know there are notes you should be taking there. Keep in mind that in order to earn full credit on your diagrams, you are not only expected to have your labels filled out, but you should also have your physiology notes. Personally, I recommend you do this in 2 colors just to help with your studying. So doing the anatomy labels in 1 color and your physiology comments in another. But whatever works for you, let's go ahead and get started with this first page, which is anatomical position in terms of direction. I'm going to go a little bit out of order, not much, but let's go ahead and start with this guy at the top left. He is standing in what we refer to as anatomical position. It's important to be familiar with anatomical position because anytime you're reading an article or document about anatomy and they're talking about the individual's structures, they're going to talk as if the person is in anatomical position. So that means that the individual is facing you and their palms are facing you. That way it's kind of like universally known that if they're referring to certain body parts, that you're understanding the direction that they're referring to. Okay, that's all I have for that. Let's go ahead and start with the term meaning towards the top, which means superior. Okay, so if you think about it, whoever is the top boss at your work, they are known as your superiors, or something that is, above all the rest is known as superior. Yet being below or towards the bottom is inferior. Okay. When it comes to left to right terminology, something that is towards the midline is known as medial. Okay, so medial means in the middle, and so opposite of that or out to the side is lateral. Finally, on this guy we have terms E and F. E is talking about close to the trunk. This term is proximal. And a good way to remember this is when you use the term proximity, you're referring to close proximity, whereas the opposite of proximal is distal, and I like to think of it as it's a distance away. With these terms, it's important to know that they are relative to one another, okay? They're going to change based on the structures you're talking about. So for example, if you are comparing your elbow and your hand is further away from your trunk, at least the attachment point. So therefore your hand is distal and your elbow is proximal. However, if you then change up what you are comparing your elbow to, say to the shoulder, the elbow is no longer proximal. Okay, the shoulder will then be proximal and the elbow will be distal. Okay, so the term that you use is going to be based on what you're comparing that structure to. Okay, so you're going to have to think about, okay, which is further away in this scenario versus another scenario. Okay, so the terms that you use might change. Here we have a lateral view of this female. meaning we're looking at her from the side. So since we're on the same page, our terms are going to stay the same for the same labels. So A is still superior and inferior. If we're talking about her hips versus her feet, her hips are proximal while her feet are distal. But now we have two new terms to talk about front versus back. And there's two different terms we can use here. The front is referred to as anterior or posterior. Or they can be referred to as ventral and dorsal. Okay, so those terms regarding a human are interchangeable. Okay, so if you want to say posterior or dorsal, typically we say posterior. That's fine. You can swap those. However, in a quadruped, such as a dog, those terms are no longer interchangeable. Okay, the head end of a quadruped is anterior, and the tail end of a quadruped is posterior. It's then its back that is dorsal. So if you think of how, a dolphin has a dorsal fin, dorsal meaning the fin that's on its back, right? And then ventral being its stomach. Okay, so while anterior and ventral are synonymous in a human, they are no longer synonymous in a quadruped. Okay? Let's go ahead and move on to our next diagram, which is anatomical planes. All right, so here we've got a few to talk about. The first one, A, is your frontal, also referred to as coronal. Some terms or some of the structures inside your body are named for their planes. So you'll see this again, especially when we talk about bones. But your frontal means that you are separating front and back. So this is if you were to cut her in half so that she has a front half and a back half. Yep, we're talking about cutting people. Sorry, guys. If you were to cut her in half to separate top and bottom, you would have what we call transverse cuts. This may also be called a cross section. So again, a transverse plane or a cross section is going to separate the top from the bottom. And then finally, we have our sagittal cut, which means you're separating into left and right. If a sagittal cut is going to give you equal left and right pieces, meaning you're going straight down the center, we then call it median or mid-sagittal. You will see the term mid-sagittal more frequently than you will see the term median, but I just want you to be aware of them, okay? And so down here, we have the brain, and we're just showing you how these cuts could be displayed using an organ. So here we have our frontal. So we have a front half and a back half of the brain. Here we have our transverse, where we have a top half and bottom half. And then lastly, we have a cut that's going directly down the center. So it's mid-sagittal. Good. This is something that you should be familiar with thanks to biology. Well, hopefully. This is our hierarchy of the body. So if we go from largest to smallest, we can start off with the organism. The organism consists of organ systems. The organ systems consist of organs, which are made of tissues, and those tissues are made of cells, which are the smallest level of life. And I don't really like how they have this arrow. I'm going to draw my own arrow. From cells, we then have the organelles that are within or make up the cells. And I just spelled organelle wrong. And then organelles are made of molecules, which are made of atoms. Pretty simple, not a whole lot of physiology here. The reason I included it though is because for each unit that we cover, we're going to talk about the cells and tissues involved before we actually work our way up to the organs that make up that particular organ system. Okay. And then the whole year we're focusing, of course, on the organism. All right. Abdominal regions. Let's talk about this. These are going to be pretty much just named for their location. Some are named for what is within that location. So let's go ahead and talk about these. We're talking about the right hypochondriac. Even though it's on our left, we always refer to things based on the specimen. So this is the right side of the specimen. We then have the right lumbar, which is also known as the right lateral, meaning off to the side, abdominal. And then I'm going to jump down to our last right side. We have the right inguinal. The inguinal is a term that's often used when you're referring to things regarding the groin. Another term that might be used is iliac. And the iliac is the part, it's actually a bone that helps make up the pelvis that rests right here. So this is the iliac right here. And so you might hear that term as well. If we move to the center, we have the epigastric. Epi is a term meaning above, and gastric means stomach. So this is the section above the stomach. We then have the umbilical, which is the section containing your belly button, because that's where you had your connection of your umbilical cord as a fetus, long, long ago. And then you have your hypogastric down here. And hypo is the prefix meaning below. And gastric, again, meaning stomach. So this is below the stomach. On the right-hand side our right-hand side, left-hand side of our specimen, we then have our left hypochondriac, okay, which chondro means cartilage, and you actually have cartilage connecting your ribs to your sternum. I failed to mention that on the first one. Okay, so hypochondriac meaning below the cartilage. So the left below the cartilage section. You then have your left lumbar, or left abdominal. And then finally, our left inguinal. Or iliac. If we want to generalize, so if you've ever gone to, say, the doctor, or if you've gone to patient first and you're complaining of different symptoms, say aches or pains, and they have you lie on your back and they feel your stomach, they kind of apply pressure, they're going to apply in quadrants. So that way, if you report any type of pain, they can then include that quadrant in their report and then focus on just the organs that might be causing your symptoms within that quadrant. Okay, so these are pretty simple. You just have your left upper and your right upper, and then your left lower and your right lower. So that's why they don't just kind of feel around all willy-nilly. They kind of go methodically across your stomach and then work their way down. So that way, when you report any discomfort or pain, they can kind of isolate what might be going on there. All right. I skipped these. Here we go. Let's talk about body regions. When it comes to terminology for the body, we don't necessarily use our layman's terms. We have anatomical terms that we use, and they're going to be more frequent when it comes to various reports and readings. And so we want to be familiar with these terms and get to know these terms. A lot of them also you're going to see again when it comes time to go over bones and muscles, and so they'll make sense then as well. All right, so let's start at the top and work our way down. A is cranial. And if you look off to the side, it says that cranial focuses on the head. I just want you to make a note that cranial specifically relates to the skull. Okay, so it's not they generalize it as the head, but technically cranial is referring to the skull. We then have facial. That one's pretty simple. And then C is cervical. I want to talk to you about this a second because for most of you, when you hear of cervical, you think about female anatomy, being the cervix. So you've probably heard of cervical cancer. Cervical is actually a term meaning neck. And the reason that we have a structure in the female known as a cervix is because, and don't judge my drawing, if you have seen the female reproductive system, so say this is the vagina here, and we're looking at a sagittal view, meaning we're cut into left and right, what happens is the uterus is kind of circular, but it has this muscle here. It's kind of like a ring. And this, hang on, let me redraw this. If this is the uterus right here, this section right here is a muscular ring that connects to the vagina. It's kind of like if this was a face and this is the neck. So the cervix is like the neck that holds up the uterus. Okay. I apologize for how awful my drawing it is. It's just that that's a very common question that I have gotten in the past. And I just want to clarify that cervical means neck, and the cervix is like the neck of the female reproductive system. All right, moving on. We've got the deltoid, which is convenient because the muscle right there is known as the deltoid. The center of the chest is sternal, where your sternum is. And where your pecs are, we refer to as pectoral. So that's your chest. Your arm is brachial. You're going to see this again when we get into nerves, because the plexus of nerves that runs through here is the brachial plexus. And then, let's see, we're just going to keep going in order of these letters here. H is abdominal. And I, which is your forearm, is the antebrachial. Your hips here are coxal. And then your hand is manual. And then when we get to L, we have our digitals. You may also know them as phalanges, but that's more so when we're talking about the bone structure. M, again, I mentioned this in the abdominal diagram. When we're pertaining to the groin, it's referred to as inguinal. Very common in males is, especially at birth, is inguinal hernias, which require surgical intervention. So for some reason, for a lot of males, when they're born, if there's been any type of developmental issue here, they may have a hernia that has to be sewn up before they can be sent home with mom and dad. Okay. Here is where your femur lies. Conveniently, this region is femoral. Your knee is known as genicular. Your front of your lower leg, like where the tibia is crural. Your foot is known as pedal. Okay, so as humans, this is why we're referred to as bipedal. Okay, bipedal means we have 2 feet, we walk on 2 feet, whereas quadruped quad, meaning 4 feet. And then lastly, your toes are also digital. All right. We've talked about the anterior view, so let's talk about the posterior view. I mentioned in the last video that cranial is more so regarding the skull. Cephalic is a term that's more related to the head in general, and especially regarding the brain as well. So if you've ever heard of somebody having encephalitis, this is itis meaning inflammation of, cephalic meaning the brain, so swelling of the brain. So if you ever heard that meningitis or meningococcal meningitis can lead to encephalitis, like if you've ever seen the vaccine commercials, they're talking about it can lead to swelling of the brain, which is very dangerous. Nuchal, while B is pointing to the neck or cervical, nuchal is specifically used to talk about the nape of the neck or the back of the neck. There's also a lot of terms regarding fetal development when it comes to nuchal measurements as the baby develops. So if we are able to cover fetal development at the end of the year, you'll see this term again. Where the scapulas are, or your shoulder blades, we refer to this as scapular. The arm is still brachial. The center of the back is vertebral, where your vertebrae are. Your elbow is known as olecranon. Now I know that sounds a bit strange, but it's actually named for the process that makes the pointy part of your elbow. You will see this again when we get into the skeletal unit, when we talk about the bones of the forearm. The lumbar region, we could actually kind of connect. So lumbar meaning the low back. Our forearm is still antebrachial. And we have the glutes or gluteal, femoral. And although the anterior knee is genicular, the posterior knee is popliteal. The calf is sural. And finally, named for the bone that makes your heel, we have calcaneal. And that bone that makes that up is actually called the calcaneus. Just 2 more to go in this video. Let's talk about the body cavities. First off, we can divide our cavities into 2 categories. One being towards the back of the body, the other being towards the front of the body. So for the back of the body, it's the dorsal body cavity. While the cavities that are in the front are known as the or they make up, the ventral body cavity. So if we look at dorsal, which we can really see in the lateral view, so this whole region is dorsal. The top part, the cavity that's created by the skull, is the cranial cavity. And again, it's called cranial because it's made by the skull. And then the cavity which fits your spinal cord is the spinal cavity. And those are the two cavities that make up the dorsal body cavity. The ventral body cavity is a bit more involved because it has two subcategories, one being thoracic, the thoracic body cavity, and the second being the abdominopelvic cavity. And I'm going to switch up my colors here. If we look at the thoracic body cavity, the thoracic body cavity is referring to everything above the diaphragm. Okay, so the diaphragm is this muscle here that controls breathing. And it consists of a few other cavities. One being the mediastinum, which is this one and this one combined. And if we just isolate this bottom portion of the mediastinum, we have the pericardial cavity. Peri is the prefix meaning surrounding, cardial meaning heart. So this is going to be the cavity surrounding your heart. And off to the sides, we then have what we refer to as our pleural cavities, which house the lungs. That's it for thoracic, so everything above the diaphragm. So let's go ahead and talk about what's below the diaphragm. Below the diaphragm simply is our abdominal cavity. So this is mostly your digestive organs in this area. And then we have our pelvic cavity. And the pelvic cavity is encased by the pelvis. Okay? All right. And then the final one, which I'm going to scroll to, we have movement at the joints. I need to get to because I went a little out of order, but I feel that it makes sense. Oops, wrong way. Here we go. All right, so because we went over anatomical terminology, I felt that we should do a little bit of movement terminology. And so this diagram is movement at the joints. I'm going to go a little bit out of order. But first off, if we look at her arm here, if you are bending or decreasing the angle at a joint, it's called flexion. Okay, so flexion, you're decreasing the joint's angle. Opposite of that, if you're increasing the joint's angle, you have extension. Okay, so flexion, you're typically bending. Extension, you're normally straightening out or increasing the angle. If you increase beyond your normal position, it's referred to as hyperextension. Okay. If we look at the guy on the right-hand side here, he is abducting and adducting. You may actually be familiar with these terms if you've ever taken a weightlifting class. A lot of the machines are named for the function. Abduction or abduction is when you're moving the limb away from the midline. Okay, so AB, away. Whereas adduction or adduction, you're adding to the body. You are moving towards the midline. Okay, and then lastly here, we have two types of rotation. One, if you're rotating inward towards the midline, it's referred to as one of two. Here's one of two options. You can call it internal rotation, because you're rotating inward, or it's also called medial rotation. And again, it's because you're rotating in towards the midline, towards the middle. Opposite of that, you can have external rotation, or lateral rotation. And this means you're rotating out towards the side, away from the midline. Okay? So that's all we have for this video, covering different anatomical terms, movement terms, and just basic anatomy, anatomical direction terms.